Thank you, Madam Speaker. Now, as I'm sure you're aware, Labor and the Greens have our fair share of differences and disagreements across many issues, and that's how democracy works. Health, however, is a shining example of the ACT Greens and Labor working constructively together to achieve better outcomes for people, and perhaps even a useful case study for our colleagues on the Hill. Now, my ministerial responsibilities cover both health and community services, two areas which are intrinsically linked. Budget debate conventions will force temporary split in this happy marriage while we debate budget initiatives and health and community services spaces separately, but I will emphasise that health improvements aren't just achieved through acute health funding and hospital beds. Now, to quote my crossbench Greens colleague Jonathan Davis, the best kind of hospital is an empty one. As the Minister responsible for mental health and justice health, I strive to ensure that people in the ACT receive the best healthcare possible. Having access to care at an earlier stage in their illness, as close to home as possible, reduces barriers to good healthcare and helps people on their recovery journey faster. Within my community services responsibilities, I'm also working to take strain off the acute end of our health sector by helping Canberrans improve their wellbeing and change the social determinants that can lead to mental ill health or poorer physical and mental health for people in the justice system. Now, Madam Speaker, when people are supported in their mental health and wellbeing, the entire community benefits. In the 2023-24 ACT budget, we're investing $241 million to support mental health, and this is roughly 10% of total health expenses. There is a strong focus on investing in and improving access to early intervention support so people can get the help they need before reaching a crisis point and continue to stay engaged and connected with their communities. For example, in this budget, we've dedicated $2 million to establishing a safe haven at the Canberra Hospital. Following the success of the first safe haven in Belconnen, which provides warm and welcoming care for people in distress, we will soon have a second safe haven to support people in Canberra South. This is what was recommended by the co-design team for the safe haven, a team that included clinical experts, advocates, carers and people with lived experience of mental ill health. And by staying true to the original intent of the co-design team, we will have safe havens in the community as well as an alternative to the bright lights and noise of emergency departments for people in distress seeking help on the hospital campus. It's really important that we continue to invest in safe, non-clinical spaces such as this, where people can receive support led by peer workers who've been through tough times themselves and understand what's most needed in times of crisis. Peer workers often also have a strong understanding of the social determinants of mental wellbeing, how situations like relationship breakdown, job loss, housing insecurity or experiences of violence contribute to distress and make it harder to regulate challenging emotions. We will continue to expand this service by considering where we can have more safe havens in the ACT, providing better outcomes for people in a time of need and take pressure off our emergency departments. Now, in this budget, we've also provided funding for the operation of the ACT's first residential treatment centre for eating disorders, which will officially open in Coombs in mid-2024. This will be the first free-of-charge residential treatment centre to be built in Australia and will support people with this complex mental health condition to continue their recovery journey in a supportive, home-like environment. This is a really crucial step in ensuring that people with eating disorders receive the right level of care for their stage in their recovery process. And it was driven by years of work by a reference group here in the ACT that includes clinicians, academic experts, community advocates and people with lived experience, and continues the good work that was started by our First Minister for Mental Health, Minister Shane Rattenbury. I know that we have more work to do to ensure that a continuum of publicly available eating disorder services are offered in the ACT in line with the territory-wide model of care. Establishing an eating disorder day service in a future budget will ensure that there is support for people with eating disorders who are medically stable but need more time to be psychologically ready to attend the residential centre. And this would also be in line with the focus on the stepped model of care and integration between services in the National Eating Disorders Strategy 2023 to 2033 that was launched today by the National Eating Disorders Collaborative. It's really great to see this national focus on what's needed for an effective, equitable, coordinated system of care. With the ACT already having established a clinical hub in January 2022, the early intervention service delivered by Catholic Care in February 2023, and the service delivery for the new residential treatment centre to be delivered by Canberra Health Services from mid-2024, and my clear intention that we'll also have a day program in a future budget, as well as ongoing support for prevention activities, including those delivered by community sector partners such as MEACT and family support such as that provided by Eating Disorder Families Australia. The ACT is clearly thinking along the same lines as what we're seeing in the National Eating Disorders Strategy. I'm also really pleased to announce that funding for the second Police, Ambulance and Clinician Early Response, or PACER team, has been extended for 9 months. Our 2 PACER teams, which run 24 hours a day, 7 days a week, continue to be an ongoing success in the ACT. We've already learned a lot from the pilot, and I will be looking to make this service even better in future budgets by looking for additional services to support people attended to by PACER, such as a safe space for people in crisis who cannot be at home or do not require acute care from hospital, such as crisis or respite care. In this budget, we're also extending funding for crucial youth mental health programs such as Woke and Stepping Stones that were previously funded by the Commonwealth Government. It is really disappointing to see that the Commonwealth Government has discontinued funding for these critical services for our community from 1 July this year, and it's clear that the previous federal Liberal government did not plan to properly evaluate these programs or plan for their future when they originally funded these programs, which is actually a bit surprising for a party that claims to be good at economic management. Now, I note the strong support for both Woke and Stepping Stones from community members who've advocated strongly for them to continue. And I will continue to advocate to the Commonwealth Government to step up and support funding for these programs in the long term. But right now, I'm here to say that the ACT Government will not leave our young people and their families stranded now that the Commonwealth funding has ceased. This budget also continues funding for the MindMap Youth Mental Health Navigation Service and the Youth Aware of Mental Health Education program in our high schools, which were pilots originally funded through a partnership with Commonwealth Government. The funding continuation includes evaluation to better understand how to improve these services further and what resourcing is needed for ongoing service. And there is funding in this budget to improve the interface between mental health and alcohol and other drug services, improving the skills of workers in both sectors and building stronger connections between community and hospital-based mental health and alcohol and other drug services. This reflects the advocacy of many of our community organisations, people with lived experience and their carers and families, that both mental health and alcohol and drug dependence should be treated in an integrated, person-centred way. Madam Speaker, it's so important that we're continuing to build a system where people are empowered to access the support they need for their mental health when they need it and in the right therapeutic setting. I believe we've made significant progress towards this vision in this 23-24 budget, and I look forward to continuing to build on what we've achieved so that we can live in a kinder, more supportive community. Madam Speaker, these budget initiatives are life-saving and life-changing. Ever since the Greens secured a dedicated ministerial portfolio for mental health, we've seen bigger and better budget initiatives year on year. Diversifying our healthcare services, focusing on prevention and early intervention, increasing peer workforce capacity, improving accessibility and doing more of what works. People get better outcomes with Greens in government.